The most common concern about active surveillance I hear is that the cancer is going to grow and spread by the time I have treatment if I don't treat it now. The fortunate thing there is that we know from studies done here in British Columbia, but also elsewhere, that extremely rarely happens. So basically, by far and away, the vast majority of the time, if the cancer does show evidence of progression, is local, and the cure rates when treatment is given a little bit later in an active surveillance program still seem to be excellent the vast majority of the time. And on active surveillance programs in appropriately chosen patients with prostate cancers that are not too big as far as we can tell, with a low PSA, low Gleason score, and a low stage, very rarely die of prostate cancer, at least within 10 to 13 years. So, now, again, I can say that till I'm blue in the face and some men still worry, but those are the facts, such as they are. Another worry people have when they are on active surveillance, but I guess also with other cancers, is that they cannot be sexually active because of one of two things. They will worry, for example, that untreated prostate cancer will be spread to their partner by sexual activity. That does not happen. Another aspect of that worries them about sexual activity, particularly in active surveillance, is that sexual activity will make their untreated cancer grow. That does not happen either. So that's fine. And so basically I can put people's minds at rest on that. One other worry men have about active surveillance, which does necessitate the repeat biopsies every few years, is that the repeat biopsies will make the cancer worse and or cause the cancer to spread. That's actually a worry that we had in the early days of doing prostate biopsies many years ago. Many studies have been done, and no study has ever shown that doing a prostate biopsy makes prostate cancer grow. So another concern or question men will have is whether there is anything they can do during active surveillance to make extra sure their cancer doesn't turn bad on them or progress or to the point that it requires treatment in their lifetime. Now, there is a little bit of science on that, although it has to be said that it is quite incomplete. There is some evidence that exercise may be helpful. Now, exercise is probably helpful anyway for everything else. My advice there, and it's the one I always give older men, is if you have not engaged in an exercise program for some time, please check with your family doctor before you embark on one. And any, personal trainer in a gym would recommend that as well. But basically, once you've done that, certainly exercise may be good. Now, of course, there are all kinds of questions and concerns men have about how to do that if they haven't done it for a long time. Usually I'll say, well, I would start by weaving it into your daily activities. So leave the car at home and walk the 4 blocks, take the stairs rather than the elevator, all those sorts of things, and then build on that. Diet, basically what evidence there is suggests that the diet that's good for other things, lots of fresh fruits and vegetables of different colors, lower fat, limiting red meat, those sorts of things may be good for prostate cancer. And of course your family doctor will love it for other things as well. And so talking about that with the doctors looking after your prostate cancer is certainly worthwhile. And it's something to talk about even for men who have had treatment for prostate cancer. We don't know, but it may be helpful in the survivorship phase post-treatment. The other question men have as well, in addition to all of that, should I see a naturopath? Should I be doing other, therapies and things? And of course the difficult thing about that is we don't know what they do. Of course we don't know what they don't do either. It's possible some of them might help. But I guess the thing about that is just to kind of keep your consumer's hat on when you're looking at these things, and in terms of expense, but also, and of course that's hard to do when you're scared and stuff, but if you can sort of be a bit analytical about what you're looking at. But also bear in mind, just because something's natural doesn't mean it doesn't have side effects, and it can be inconvenient as well. So you just want to look at all the different features of a particular program you may be considering. Men will often look at these things even if they are having treatment for prostate cancer, but maybe they're a little bit more likely to come up if men are thinking more active surveillance because it is, quotes, something I can do, end of quotes, since I'm not having surgery or brachytherapy, for example.